Hello everyone and welcome back to session 51 of the medical debate. Today we're going to be discussing pandemics, which is obviously a very topical issue and one which many people have some misconceptions about. So hopefully we're going to clear things up about what pandemics really are, how they're categorized and how their severity is measured, and also whether the effects of pandemics can be mitigated and whether the consequences of pandemics should be controlled using measures such as lockdowns. So first of all, what is a pandemic? Please pause the video at this point and have a think about this question. If you want, you can put a comment down below explaining what you think a pandemic is and how it differs from something like an epidemic. Okay, so hopefully you've had a chance to pause the video and have a think about this first question. A pandemic comes from the Greek pan, meaning all, and demos, meaning people, and is defined as an epidemic of an infectious disease that has spread across a wide region. So, throughout history, numerous pandemics have occurred, including smallpox. However, the most fatal pandemic recorded in history was the Black Death, also known as the Plague, and this was responsible for the deaths of 75 to 200 million people in the 1300s. The 1918 Spanish flu pandemic, which was the spread of influenza, was another notable example of a pandemic. Currently, HIV, tuberculosis, and COVID-19 are examples of pandemics which still exist in the world, and they're categorized as current pandemics. Cancer is not considered a pandemic as it is not an infectious disease. So pandemics are defined as such because of the reason that they spread from person to person over a wide area. Flu is currently not defined as a pandemic, although it does spread across a wide area due to the fact that it occurs simultaneously all across the world, and it has relatively stable numbers of infections. So usually cases will arise in individual communities, and the incidence of flu around the world is not caused by the wide spread of the virus. So on 11th March 2020, the World Health Organization characterized the spread of COVID-19 as a pandemic, marking the first global pandemic since the 2009 swine flu pandemic. So that's just a little bit of background about pandemics, and obviously how COVID-19, the most notable and most recent example of a pandemic, plays into that. So we're going to look a bit now about how categorization of pandemic phases occurs, and this is the way in which the World Health Organization, or the WHO, categorizes pandemics. So here we have a table showing the different phases of the influenza pandemic and the descriptions of the phase. So during the first three phases, this is where animal-to-animal infection occurs, and then animal-to-human infection, and then clustered cases in humans. And at this point, there's an uncertain probability of a pandemic. And notice how the World Health Organization categorizes this via certainty, because they are still not sure. It's impossible to know the exact numbers of people who are infected. However, this is a prediction of how pandemics work. During phases 2 and 3, it is considered a human pandemic threat, and there are no sustained community-level outbreaks. But these are just mainly small numbers of cases. It is not spread over a wide range or wide area in many people, and there won't be many fatalities at these stages. During the next 3 stages, this is when the pandemic really picks up, and in phase 6, a pandemic is declared, and there will be a pandemic in progress at this point. In phase 4, there's a medium to high probability, and phase 5, a high to certain probability. In terms of how pandemics are the pandemic is spreading through people, or how the pathogen is spreading, there are sustained community-level infections and outbreaks, and then in 2 countries in one WHO region. So this is when the pathogen will start to spread between countries and eventually across the world. After phase 6, the post-peak occurs, so this is when levels start to drop again as more people gain immunity, or the spread is mitigated through methods such as vaccination. There may be a possible new wave, and we've seen that in COVID-19, and activity is rising again in most countries, and then after post-pandemic. So at this stage, levels will return to ordinary seasonal levels. This does not mean that the pandemic is completely gone. This does not mean that the pathogen has been eradicated, because that is more or less impossible. So in terms of COVID-19, this would be a stage where people are no longer wearing masks, where there are no more lockdowns, and people are able to get on with their daily lives. COVID-19 would still exist, and there would be a number of cases at any given time, but there would be ordinary seasonal levels, meaning it is not a cause for concern or a cause for threat, and people are able to go on with their lives without being concerned about catching COVID-19. So and obviously you can see below that some of these apply to only countries with the systems and technology available to survey this data. So obviously these phases might be categorized slightly differently in different countries. So we're going to talk now about the severity of a pandemic and how a pandemic severity is actually measured. So the PSAF, or the Pandemic Severity Assessment Framework, is used to assess the severity of pandemics. It rates the severity of a disease outbreak on two dimensions: clinical severity of illness in infected persons and the transmissibility of the infection in the population. Both dimensions are measured by more than one metric. Transmissibility can be measured, for example, as the basic reproduction number, R0, and you may have heard of this in the news with regard to COVID-19. Usually, if the number is between 0 and 1, then over time the number of infected people, or rather the rate at which the infection is growing, will decrease, whereas if it is over 1, then the disease will grow at a faster rate. And also serial interval or via underlying population immunity. These are also other methods in which transmissibility can be measured. The framework gives guidelines for scaling the various measures and examples of assessing past pandemics using the framework. So it will allow different pandemics and past pandemics to be compared in order to rank the severity of different pandemics. Historically, pandemics were classed using their fatality rate. However, due to deaths lagging behind cases, underestimates of cases, a lack of insight into the effect of minority or vulnerable groups, and a lack of insight into the wider effects of the pandemic, this is not considered an adequate metric. There may be a high fatality rate, and that can be one indicator of the severity of a pandemic. However, this may lag behind the total number of cases that exist, and that is why we've seen lags in the data for COVID-19, and also in some countries where adequate technology is not available, and where there are large populations, large rural populations, it is not actually known how many people are dying. And also different groups may be affected into different ways, and fatality rate does not necessarily give an insight into that. And again, wider effects of the pandemic, such as the economic effect or the environmental effect. We're now going to talk about how a pandemic can be managed. The basic strategies in the control of an outbreak are containment and mitigation. Containment may be undertaken in the early stages of the outbreak, including contact tracing and isolating infected individuals to stop the disease from spreading to the rest of the population, other public health interventions on infection control, and therapeutic countermeasures such as vaccinations, which may be effective if available. So essentially, this is ensuring the disease does not happen in the first place, and therefore vaccinations, against measles, for example, which are done at birth in many countries. This ensures that a pandemic will never kind of arise in the first place, and that individuals aren't affected, and that clusters can't begin to emerge. When it becomes apparent, however, that it is no longer possible to contain the spread of the disease, management will move on to the mitigation stage, in which measures are taken to slow the spread of the disease and mitigate its effects on society and the healthcare system. In reality, containment and mitigation measures may be undertaken simultaneously. So whilst usually, you would try to contain a pandemic, and then if that didn't succeed, you would attempt to mitigate its effects through lockdowns, for example, containment measures may be undertaken whilst mitigation is also being undertaken. And the most obvious example of this in terms of COVID-19 is vaccination, which we obviously couldn't do before the pandemic as we did not know it would occur. But now that we have developed vaccines, people are being vaccinated whilst we are also attempting to mitigate the effects of the pandemic by using, for example, masks, social distancing, and lockdowns. So, flattening the curve. This is a term you may have heard quite a lot in the news. You may not know, however, exactly what it means. So, a key part of managing an infectious disease outbreak is trying to decrease the epidemic peak. This is known as flattening the curve. And this is essentially decreasing the number of cases and the number of deaths caused by the pandemic or epidemic. And this helps decrease the risk of health services being overwhelmed and provides more time for a vaccine and treatment to be developed. A broad group of the so-called non-pharmaceutical interventions may be taken to manage the outbreak. In a flu pandemic, these actions may include personal preventative measures such as hand hygiene, wearing face masks, and self-quarantine, community measures aimed at social distancing, such as closing schools and cancelling mass gatherings, community engagement to encourage acceptance and participation in such interventions, and environmental measures such as cleaning of surfaces. So these are all very relevant not only to a flu pandemic, but also obviously to COVID-19, and we've seen quite a lot of, if not all of these measures being implemented across society. So these are mitigative measures, hand hygiene, wearing face masks, those are more basic ones, and obviously many events have been cancelled over the last couple of years due to the pandemic, and this is ensuring that cases don't spread and hence the curve can be flattened. So here we've got a little animation showing how mitigation can flatten the curve. What it means is that over time, the number of active cases decreases, and that eventually the number of cases reaches a level where healthcare or the healthcare system is able to cope, and therefore the NHS in the UK wouldn't be affected, or rather wouldn't be overwhelmed by an increased number of cases. However, in reality, we may see a second peak, and this second animation shows the effect of inadequate mitigation, or if mitigation occurs and then is discontinued or not effective enough. And this might be caused by reopening society after a lockdown, which may cause another surge in cases, a resurgence, and therefore levels reaching a number of cases where healthcare capacity can no longer be filled, or is rather overwhelmed again. So, the consequences of the pandemic. If you have any other consequences that we haven't mentioned on this slide, please do put them down below. It's very interesting to hear your opinions, and therefore please also give your opinion as to whether you think pandemics should be controlled through measures such as lockdowns, or whether you don't think this is an appropriate strategy. In 2016, the Commission on a Global Health Risk Framework for the Future estimated that pandemic disease events would cost the global economy over $6 trillion in the 21st century, which is over $60 billion per year. The same report recommended spending $4.5 billion annually on global prevention and response capabilities to reduce the threat posed by pandemic events, a figure that the World Bank Group raised to $13 billion in a 2019 report. So the 2019 to 2020 COVID-19 pandemic is expected to have a profound negative effect on the global economy, and that's something we've seen already in a variety of countries, potentially for years to come, with substantial drops in GDP accompanied by increases in unemployment noted around the world. The slowdown of economic activity during the COVID-19 pandemic had a profound effect on emissions of pollutants and greenhouse gases. So this is essentially a positive consequence of a pandemic, or rather not a pandemic itself, but the measures that were implemented as a result. And there have been a few other positives, such as a decrease in the spread of other infectious diseases due to people wearing masks, and obviously lockdowns and people staying at home, decreasing emissions from cars, etc. So, on the one hand, these effects may damage the global economy, but may allow us to recover environmentally, for example. So now we're going to discuss a couple of ethical questions. So first of all, are mandatory lockdowns ethical, or should it be up to individuals to decide whether they want to isolate? At this point, please pause the video and have a think about this question by yourself and put in the comments your thoughts. Do you think mandatory lockdowns are ethical? And also consider the 4 pillars of medical ethics in your answer. Okay, so hopefully you've had a chance to think about this question. You may have decided to approach this question using the 4 pillars of medical ethics, more specifically beneficence, maleficence, autonomy, and justice. So, in terms of autonomy, many would argue that it's not ethical to enforce mandatory lockdown on a population because it is going against people's personal freedoms, and many people think the government should not have a say in how people go about their daily lives to such a large extent. However, many people think that lockdowns have shown, in various studies, they've been shown to be effective at controlling infectious disease pandemics, and therefore many argue that it should be mandatory in order to ensure the best outcome and the best possible mitigation of a virus, for example, without ensuring a resurgence occurs. So, should it be up to individuals to decide whether they want to isolate? This could lead to fewer people isolating and therefore an increased spread in disease and infection. So what do you think? Do you want to consider non-maleficence? Do you think this outweighs autonomy? Or do you think the other way around? Do you think autonomy should overrule non-maleficence and beneficence? So, the next ethical question we're going to discuss is, should the economy or people's lives be prioritised during a pandemic? So, we've discussed a little bit about the effect that a pandemic can have on the economy. It can lead to the loss of trillions of dollars of countries' GDPs and mass unemployment. It can lead to people losing their skills, less education, and this can lead to consequences for many, many years to come. Therefore, many people would argue that the economy should be prioritised. However, other people think that people's lives should be prioritised, even if it means that these other factors, such as education and the economy, jobs, employment, suffer as a result. So what do you think? Do you think that the economy or people's lives should be prioritised during a pandemic? Please put your answers down below in the comments. Okay, so hopefully you've had a little bit of a chance to think about that question, and we look forward to reading your answers and possibly responding to them. That brings us to the end of our session today. Thank you very much for attending, and please do attend next week where we will have another session uploaded on YouTube. If you'd like to ask us any further questions, please contact us on our email, themedicaldebate@gmail.com, or alternatively, please DM us on our Instagram at themedicaldebate. Please do subscribe to our YouTube channel, The Medical Debate, in order to see all our future videos and watch all our old ones. And please follow us on Instagram to stay up to date on future sessions and guest speakers. The link to the source for this session is below, and you can check that out if you'd like to receive any further information. Alternatively, you can email us and we'll be happy to explain anything you didn't understand in today's session. Thank you very much for attending, and see you next week. Bye.